Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. We have Dr. Yaffe here today, so I'll turn it over to her for some brief remarks.
Thank you very much. Good afternoon, everyone. Today's update will be brief before I open it up to questions. Since I last provided an update on Monday, Ontario reported its highest one-day total of new cases on Tuesday, with 1,050 cases. Today, we're reporting 987 new cases. Most of the cases, about 70%, are concentrated in Toronto, Peel, and York. We've also seen a recent increase in the number of deaths related to COVID-19. Yesterday, we reported 14 new deaths, and today, unfortunately, we're reporting an additional 16. With respect to outbreaks, we're also seeing a continued increase. Today, there are 33 new outbreaks, and in the past week, we've seen 107 outbreaks, which is a 10.3% increase over the week before. About half of the outbreaks are occurring in our vulnerable sectors: long-term care homes, retirement homes, group homes, and hospitals. What we are learning is that in many of these settings, there are challenges with preventive measures not being followed during social times, as in breaks, and people going to work when they are ill. This serves as an important reminder for individuals to make sure they really take note of any signs of illness before heading to work, no matter how mild the symptoms. It's also important for workplaces to be very vigilant in screening their employees. I also want to acknowledge that I know how strange it is to practice physical distancing from your coworkers and to wear a mask even when you're on break. But just because you know someone does not reduce the risk of transmitting COVID-19. And this is something that I'm asking we all keep in mind, not just when we are at work. It is also important to keep in mind when we make decisions about our own personal and social interactions. So please keep up the adherence to our public health measures so we can protect each other and reduce the spread of COVID-19. Thank you very much. I'll open it to questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Colin DeMello with CTV News. Please go ahead.
Hi there, Dr. Yaffe. I'm curious about where we stand in terms of flattening or bending the curve, in terms of what level of importance is the province and public health officials still placing on that. Right now, we seem to be plateauing. Are we looking to bring the numbers down below that average of about 900 or so?
Thank you for the question, Colin. Obviously, the numbers continue to be very concerning, and we continue to review the trends. You can't just look at one day, you have to look over a period of days. But the modeling most recently showed us that the rate of increase was getting slower, which is good, and that they were predicting we would get between 800 and 1,200 cases a day, which it appears to be the case at this point. Obviously, it would be great to have the number go down, but on the other hand, we want to make sure we're aware of cases and that cases are isolating and contacts are followed up. So we want to encourage people who have any symptoms to get the test.
So a lot of people might look at that and say, okay, from a public health perspective, Ontario has kind of given up the fight to flatten the curve. Is that the sense that I'm getting here? Is that we are now in a state of kind of acceptance that this is going to be what it is? And how far are we looking at this? Are we going to be seeing these case numbers continue in the 900s, 1,000s, all the way up until Christmas, until the end of the year? Or is this more of a November thing and then we're going to come down? Just trying to figure out how far we're going with this and whether we've arrived at a state of acceptance.
No, we haven't arrived at a state of acceptance. We're working very hard to prevent and control this infection, but it is a worldwide pandemic. And as you know, actually our rate per 100,000, somebody was just telling me, is lower than some of the other major provinces in Canada. Not to say that we are still working to reduce it as much as we can. But I don't have a crystal ball. I don't know how long it will last. Hopefully, everybody will do everything they can in their own personal lives to reduce transmission. And, I'm not going to go through the same thing I've said 1,000 times, but everybody needs to wash their hands, not go out if you feel sick. I just said I wasn't going to do it, but I'm doing it. Wear a mask if you can't stay at least 2 meters away from other people. And those basic things, because that's how it spreads, person to person. And we're going into the winter, and it's going to get colder, and people will spend more time indoors. And we know that this infection spreads more easily indoors when you have close contact with between people, potentially crowding, and especially if the area is poorly ventilated.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go.
Hi, Doctor. Just picking up on from what Colin was asking. The preaching that we used to hear every day was we've got to keep community spread as low as possible so it doesn't get into nursing homes and schools. 11 of the 16 new deaths today were in nursing homes. The number of nursing home deaths is up, by my calculation, 61% in the last 7 days over the previous 7 days. What happened to keeping community spread low, and why are we, lowering the bar for when restrictions will be imposed?
Yeah, thanks for the question. Absolutely, it's true that we have had outbreaks, and we're getting more outbreaks in long-term care, and the majority of the deaths are in people in long-term care or retirement homes, people who are older with underlying illnesses. And those are obviously very concerning. We don't want those. We are working very hard with the Ministry of Long-Term Care around measures, including increased infection prevention and control, which is much better now than it was in the first wave. Human resource staffing issues, bringing in hospital infection control specialists to work with the homes, reducing general visitors, if they're in an area of high transmission. There are many measures being taken. Nevertheless, it's still a concern. And I think in comparing wave 2 so far to wave 1, it is much better, but it's not good enough. Obviously, it needs to be better. And that's why we need to keep working on community transmission, because this doesn't come out of nowhere. It comes from the community, from either somebody going into work or somebody going in to visit or a resident going out. So you're right, there are a number of deaths, and it's very unfortunate, and we need to keep working on that.
Follow up?
Where do you think, I know you said earlier you don't have a crystal ball, and I know what the modeling was between 800 and 1,200, but, some people are warning that with case levels this high, it will just beget more cases, and then we could easily spiral out of control. So what can you say to those people who think that, especially after Christmas, when it's inevitable that people are going to be getting together, that we do see a crazy spike and we end up in a lockdown in January?
Well, I know that the government in Ontario is working to balance things that impact on health. And so we know that, for example, closing businesses for a period has a very severe impact on people's mental health and their income and their stability and housing and so on. And closing schools and long-term, imposing measures on long-term care facilities also have very severe impacts on mental and social health. So government is trying to balance the control of the disease and the severe impact that can result from the measures taken to control the disease. So it's a careful balance, and we're looking at the numbers every day very carefully. And I think we're trying to keep things at the lower risk levels and not get them up to the higher risk levels where a complete lockdown would be necessary. But we'll have to see how it goes.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hello, Doctor.
Hi.
I'm wondering if the testing strategy needs to change. I know that the goal is now to have capacity at 100,000, but today it was not even meeting the 50,000 capacity. The Premier said he can't drag people in to get tested. Do you need to change the strategy to get more people in?
We are definitely looking at increasing the capacity, but that doesn't mean we need to reach that number. It means that if we need to have that number, the labs can do it. At this point, we're reaching about almost, I think, 28,500 tests today. So I think the people who need to get tested should go and get tested. If you have any symptoms, if you've been named as a contact by public health of a case, if you're part of an outbreak, if you're in a group that's recommended for testing, go get tested. But otherwise, the point is we used to have people getting tested who had no reason to get tested, and that's when you run into problems with overrunning the system and potentially false positive results. So I would encourage people, if they should get a test, please go get a test, but don't do it just because.
Follow-up?
Okay, so we know that it's spread in indoor spaces with prolonged exposure, like schools, like nursing homes, like bars and restaurants. You yourself said that it was necessary to close them down and put certain regions into a modified stage 2. Why wouldn't there be targeted testing, mandatory targeted testing, say, of restaurant staff, so that they would be tested once or twice a week? Because many are asymptomatic and don't even know they have it.
Well, I think we we recommend a number of measures to prevent and control infection in every setting, ranging from screening to social distancing or physical distancing, wearing masks, hand washing, making sure hand washing is easy to access, cohorting in schools, and so on. The whole question of screening people who are asymptomatic coming into a setting, we have had differing experiences with that. First of all, it puts pressure on the testing system when the priority should be people who are ill or contacts. Second of all, it then puts pressure as well on the public health system for following up. And it takes a few days sometimes to get the result. And in the meantime, I think that people develop a false sense of security if they're getting tested. They think, oh, well, I must be okay. But you have to be aware of your own symptoms. That's much more important. And get tested. But testing everybody in a workplace, that's a decision that a workplace employer could decide to do. But generally speaking, it will result in a number of tests that may or may not even be significant. The person may have to be retested again. And sticking to the basic measures is much more important.
Last question.
Your final question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Good afternoon, Dr. Yaffe. I wanted to make sure you can hear me first.
I hear you.
Okay, great. I wanted to ask you about some things we've been hearing specifically from the Premier about how this new plan will allow the province to move more quickly. One of the criticisms of the plan is that the yardsticks are too high here for moving communities between these colored zones. So what in this plan specifically will allow the province to move quickly if, as the critics are saying, these yardsticks are too high?
Well, the plan has just come out. We're going to implement it and see how it goes. I think from a public health point of view, obviously, as if the numbers are going up, it's a concern. We'll be working closely with the local medical officer of health for the health unit to determine the right measures. If we find that there are issues with the framework, we'll certainly be making recommendations to the government. But at this point, it's brand new. The focus is prevention. The focus is having measures implemented early on so that hopefully they don't reach the higher stages.
Follow-up, and this is the last question.
So it sounds as if, though, this is kind of the government is implementing this new plan and now effectively just taking a wait-and-see approach to see if it works. I mean, at a time when we have record case counts, isn't that a really risky strategy?
Well, as I said before, the government is working to balance a number of things that are all having significant impact on individual and population health. Obviously, COVID-19 prevention and control is extremely important. We want to also keep schools open and safe. We want to keep vulnerable people healthy. But we also want to look at the social determinants of health, the impact of closing businesses, of closing schools on people's economic, social, and mental health well-being. Those impacts can be extremely serious in terms of things like substance use, suicide, and all sorts of family violence issues. So we need to look at the whole picture.
Thanks, everyone.